Hi, my name is Kristine Dawang, your nursing teacher in Australia. Now in this video, I will walk you through how to identify and prepare to meet with a disruptive patient. Now all healthcare professionals at one time or another find themselves confronted with a disruptive patient that can be hard to handle, argumentative, angry, or even violent. Now these patients are often scared, ill, or in crisis. While that doesn't excuse the behavior, it may explain it and help you approach your patient with objectivity, calm, and compassion. Now, being able to spot a potentially disruptive patient can help you prepare and effectively respond. No surprise, a history of violent behavior, hostility, or aggression is often the first predictor of a disruptive patient. Of course, most patients never act out, and if they do, it's only in isolated moments, in times of stress or high immersion. Now let's look at the behavioral and verbal cues that can help you identify a possibly disruptive patient. Some behaviors or non-verbal cues of a possible disruptive patient may include dirty, disheveled clothing or neglected hygiene, arms held tightly across their chest, aggressive or threatening body language or actions such as clenched fists, pointing or slamming doors, heavy or rapid breathing, pacing or rapid movements, trembling or shaking, a frightened facial expression signifying distrust or anxiety, a fixed stare, frown, clenched jaw, sneer, or reddened, flushed complexion, throwing or damaging objects such as pens or magazines, sudden changes in behavior from seeming relaxed to quickly becoming agitated, sad, or excited, indications of drunkenness or substance abuse. Some verbal cues of a disruptive patient include a raised voice, speaking loudly or yelling, mumbling to themselves, swearing or making threats, or an aggressive or sarcastic tone of voice. All of these cues point to an escalated emotional state. Now, if you are aware of an upcoming encounter with a patient you know to be difficult, take some extra time to prepare. Inform and prepare your staff well in advance of a possible difficult patient situation so that any additional preparations can be made. If possible, block out extra time for that patient on the schedule. If necessary or appropriate, let your colleagues know what triggers may make this patient become more difficult. Now, before interacting with them, take a breath and remind yourself to remain objective and try not to take things personally. Focus on the care plan as opposed to any emotions you may feel. It's not always easy, but knowing that this is more about them, then it might help you manage the encounter better. Know your own boundaries. Recognize that when they are crossed, it's time to stop trying to de-escalate and time to leave and call for help from staff, security, or police. Now, a cross boundary could be when someone makes a threat, damages property, or refuses to follow instructions. Being clear with yourself and your staff will help you keep a cool head and be decisive when things. A patient may become violent for a variety of reasons. Possible factors may include patients and their families being told of a poor prognosis, patients known for seeking opioids, patients experiencing intense pain, patients who may be impaired by drugs or alcohol, or patients with an illness or disease process associated with agitation or violent behavior. I hope this video helped you. Don't forget to watch the next video on how to de-escalate the disruptive patients. Don't forget to like, comment, or subscribe and share it to someone you know that may benefit on this video. Thank you for watching.